Virtual Fracture Clinic. Greater tubercle, in brackets, GT, fracture.
Hi, I'm Tom Tressida, an orthopaedic consultant at the Royal Melbourne Hospital. At the Royal Melbourne Hospital, the Virtual Fracture Clinic is run by specialist orthopaedic consultants and advanced practice physiotherapists. In many cases, we can review your injury and provide care without you needing to come back into the hospital. This video will give you the information you need to manage your recovery. The greater tubercle of the humerus is part of the upper arm bone close to the shoulder. In young adults, fractures of the greater tubercle are often caused by high-energy trauma, such as sports injury or car accident. In the older population, they are usually caused by a fall. You can expect to feel pain and may see swelling, redness, and sometimes bruising. On your X-ray, we might see a crack or dark line. This is the fracture or break. If the bone is in good alignment, the fracture can heal on its own, given some time and support. Your orthopaedic specialist will advise the best option for you.
Treatment.
The most common treatment is to wear a sling for 6 weeks and limit loading while the fracture heals. It is important not to weight bear through the injured arm for all of 3 weeks. This means no lifting, carrying, pushing or pulling. After 3 weeks, objects up to 250 grams, like a can of drink or a mobile phone, are okay, as long as it doesn't cause discomfort. After 6 weeks, limit any lifting to 5 kilograms. After 12 weeks, you can gradually return to normal lifting. Use your pain as a guide to how much you can use the arm in the first weeks of your recovery. It is not harmful to move your arm, though there may be some discomfort. Follow the exercises in the brochure to reduce the risk of complications like a frozen shoulder. This injury is expected to heal in 12 weeks. If you're a smoker, this can slow healing time, so we advise that you cut down or quit. You will have an X-ray after the first week to check for initial position. The Virtual Fracture Clinic will contact you by phone to discuss your results. It is advisable to see a physiotherapist to assist your rehabilitation. The Virtual Fracture Clinic or your GP can help you link in with physiotherapy services to progress. If after 4 to 5 months you still have pain or problems using the arm, contact the Virtual Fracture Clinic or visit your GP to discuss.
Can I drive?
You should not drive for 6 to 12 weeks. Once you've stopped wearing your sling, a doctor or physiotherapist can clear you to drive based on physical testing.
When can I go back to work?
Getting back to work will depend on the job that you do. A desk worker may return in a few days. Someone with a very physical job may need 12 or more weeks off. Speak to your doctor if you need a medical certificate.
Can I stay active?
You can return to playing sports or the gym after 12 weeks. You should have near full range of motion back in the shoulder, at least 85% of your strength, and little, if any, pain. A physiotherapist can help you with a return to sport exercise program. Start with the exercises in this video.
Care at home.
Hi, I'm Emily and I'm a physiotherapist at the Royal Melbourne Hospital. We're going to talk about how to wear your sling and some exercises to help your recovery. To fit the sling, make sure your elbow goes into the corner of the pocket. Then fasten around the neck.
A model uses Velcro straps to attach the sling.
Ideally, your fingers should be slightly above the elbow to manage swelling. The sling may be removed for showering and sleeping when you are comfortable. You should make sure to rest and use the arm less, especially in the first few days. It is also advisable to use an ice pack or frozen peas over the area to help with swelling and pain. Do this for 20 minutes, 2 to 4 times a day. Wrap your ice pack in a tea towel or cloth. Never place ice in direct contact with your skin. If your pain is not improved with rest and ice, you could try over-the-counter pain relief such as Panadol or Nurofen. If you are still very sore, consider an appointment with your GP to talk about other medications. After 2 or 3 days, start these simple exercises to help your recovery. You should do your exercises 4 times a day or more if comfortable.
Exercise 1. Shoulder shrugs and shoulder blade retractions.
This exercise can be done with your sling on or off if you prefer. Keeping your arms down, gently shrug your shoulders up towards your ears, then slowly relax.
With arm and sling, a model shrugs her shoulders up and down.
Next, tighten the muscles between your shoulder blades, then relax. Repeat this 10 times.
The model pulls her shoulders back and forth. Exercise 2. Finger range of motion.
Bend your fingers down like making a fist, then open the hand out wide. Repeat this 10 times.
The model opens and closes her fingers repeatedly. Exercise 3. Elbow flexion and extension.
Bend and straighten the elbow. You may like to use your non-injured arm to assist. Repeat this about 10 times.
The model continues to raise and lower her right arm. Shoulder pendulum exercises after 2 weeks.
Keeping the elbow tucked into your side and bent to 90 degrees. Rotate your palm over and back to feel a mild stretch. Repeat this about 10 times.
Exercise 5. Shoulder pendulum exercises after 2 weeks.
After 2 weeks, you can add the following exercises. Remove the sling and holding a firm surface with your non-injured arm, lean over and gently swing the injured arm in circles. Then, front to back and side to side. Repeat this 10 times.
Exercise 6. Active assisted shoulder flexion after 4 weeks.
After 4 weeks, you can add this new exercise. Use your non-injured arm to assist. Gently reach towards the sky until you feel a stretch or discomfort. You may not be able to lift very high at first, but movement will improve with time and practice. Repeat this 10 times.
Exercise 7. Active assisted shoulder external rotation after 4 weeks.
Keeping your elbow tucked to your side, hold something light, like an umbrella or broomstick. Use your non-injured arm to help rotate the injured arm outward and back again. Repeat this 10 times. It is normal to take 6 to 12 weeks or more of exercises to regain movement. If you have stiffness or weakness persisting after that time, it may help to see a physiotherapist. You can see your own physio locally or contact the virtual fracture clinic to arrange a physio appointment at the hospital.
It's important that you understand these instructions. You're in charge of your own health. If you have any questions about your recovery, contact your GP or the virtual fracture clinic.
The Royal Melbourne Hospital.